The glomerulus is a tiny ball-shaped structure and it is part of the nephron. Capillary blood vessels make up the glomeruli and can be described as tiny filters that remove waste from the blood to form urine. Glomerulonephritis, or GN, is inflammation of these filters. GN reduces the ability of the kidneys to filter blood properly. It also influences a lack of protein in the bloodstream because it gets expelled from the body in urine. The pathogenic mechanisms of GN are numerous and complex, involving both humoral and cell-mediated immune responses. Deposition of immune complexes is followed by an inflammatory response with activation of the cascade of the complement factors. When inflammatory changes occur, effector cells become activated and induce other abnormalities that may result in rapidly progressive renal insufficiency and GN. The nephrogenic immune responses exhibits both humoral responses, which leads to immunoglobulin deposition formation and complement activation in glomeruli, and cellular components, which contribute to the infiltration of glomeruli by circulating inflammatory cells and crescent formation. Macrophages activated by T cells release inflammatory substances such as cytokines, therefore triggering fibrosis of the glomeruli. There are two types of glomerulonephritis, acute and chronic. Acute GN develops suddenly. An individual may get this after an infection in their throat or on their skin. The early symptoms of the acute disease are puffiness of your face in the morning, blood in your urine, less urination, shortness of breath, constant coughing due to extra fluid in your lungs, and high blood pressure. Chronic GN will usually develop silently, so without symptoms, over several years. It often leads to complete kidney failure. Early signs and symptoms may include blood or protein in the urine, high blood pressure, swelling of your ankles or face, edema due to water retention, frequent nighttime urination, and very bubbly or foamy urine. The treatment of GN is still empirical and aims to reduce blood pressure, especially if the patient is experiencing proteinuria. This is usually reduced with the use of ACE inhibitors or angiotensin inhibitors. Utilize steroids. Corticosteroids are used to reduce swelling and suppress your immune system. Utilize immunosuppressants. These medicines suppress your immune system. Suppressing your immune system can be effective, but it also increases your risk of infections and can cause other side effects. GN, if severely serious, can result in kidney failure. Thus, the following treatment therapies will be advised. Hemodialysis is a process of purifying the blood of a person whose kidneys are not working properly. Peritoneal dialysis. During peritoneal dialysis, a cleansing fluid flows through the catheter and into your abdomen. The peritoneum acts as a filter and removes waste products from your blood. After a set period of time, the fluid with the filtered waste products flows out of your abdomen and is discarded. If all else fails, a renal transplantation is required. To manage GN, the following actions can be taken. Restrict your salt intake to prevent or minimize fluid retention, swelling, and hypertension. Consume less protein and potassium to slow the buildup of waste in your bloodstream. Maintain a healthy weight. Controlling your blood sugar level if you have diabetes, and remember to always take your daily medications.